Alright, now for the next stuff which we'll get to discuss about is the epidemiology of neonatal jaundice. Okay, epidemiology of neonatal jaundice. Right. So, epidemiology is like just trying to glance at how this disease condition has actually affected different populations worldwide. Do you understand? It's not really like going into history. So, neonatal jaundice affects about 60% of babies that have actually reached their complete stay in the uterus, that's term, and babies that have not reached their complete stay, having all those immature organs and all of that, they're actually more at the risk of having the jaundice. So it's actually one of the most commonly treated medical conditions in babies. So sometimes it is there and won't cause several issues, but sometimes it can actually cause issues, right? So mild jaundice is seen in majority of newborns and typically resolves without intervention, while severe one estimates about 1.1 million children annually, and the highest place having that population is sub-Saharan Africa and the South Asia. Okay, so 2023 meta-analysis found that the severe neonatal jaundice accounts for about 4.3% of neonatal hospital admissions in the whole world. So higher rates in countries that are just coming up. The healthcare systems are not standard and all of that. So the severe one could actually lead to a brain damage known as a kernicterus. This is when bilirubin actually crosses the blood-brain barrier, okay, to go and cause some neurological issues. So it could actually lead to the death of the baby due to convulsions, confusions, coma, and the rest of them. So sub-Saharan Africa and South Asia reports the highest rates of severe neonatal jaundice. The risk factors that's what will actually make it easier for a baby to having the jaundice. If they have a glucose 6-phosphate deficiency, okay, the rhesus and blood group ABO incompatibility between the baby and the mother, prematurity, sepsis, poor feeding or dehydration. Sometimes it could actually become severe because it occurred and the mother kept the baby at home and the diagnosis was not made quickly. So public health implication is early detection and treatment can prevent all those complications we listed. Community education, so you educate mothers so that they know about jaundice, not that when they see jaundice they are thinking about another thing, or they are thinking that that's how their baby's skin is. Do you understand? So the World Health Organization and global health partners advocate for scalable interventions like filtered sunlight phototherapy and point of care bilirubin meters in regions that don't really have the standard health cares. So this is a map trying to show the density. All right, now there's a color coding down here which you should pause to observe this map and make use of it. So the dense areas, okay, depends on percentage of babies being born at that time.